Good afternoon, folks. Jay Gazelle here, Genesee County Manager in the old Genesee County Courthouse. Today we're going to do another one of our briefings, press updates with regard to how our two counties, Genesee and Orleans, are dealing with the C-19 and all the other emergency services implementation plans and dealing with the state of New York and the directives that are coming from them. I'm going to turn this over immediately to Paul Pettit. We'll also have, most likely speaking, Dan Arlen from UMMC, RGH, and if needed, those people plus Tim Yeager, our own Master of Disaster Emergency Management Officer, will also be available here to answer questions. Paul.
All right, good afternoon, and thank you, Jay. Once again, we are here at 4 o'clock trying to provide factual, the most up-to-date information that we can to our residents here in Genesee and Orleans County. And we're going to continue to work hard to do that, to make sure that everybody is up to speed and fully aware and be able to prepare and respond appropriately as this outbreak continues. So again, I'm going to start off with our key lines here. We need to continue to practice social distancing. Stay home if you're sick. We don't want folks out and about and in other places, going to our emergency rooms, our urgent cares, providers' offices, etc. if you are ill. It's important to continue to wash your hands and adhere to those different guidelines. It's very important as we all are in this together, and we need to make sure we're protecting one another by taking care of ourselves. So a brief situational update. As of 2 p.m. today, again, we said yesterday we're going to be cutting off the time frame here just so we can pull the information together. So as of 2 p.m. today, the lab confirmed positive cases of COVID-19 in Genesee and Orleans County has not changed. We still only have one confirmed case in Genesee and one confirmed case in Orleans. And again, the positive individual that were reported yesterday in Orleans County is still isolated in another state. So they are not here locally, but being checked in on in another state. We continue to do our local contact tracing, as I mentioned yesterday, in regards to these positive cases in both of our health departments. And we continue to develop and find more exposures as we trace that backwards. Again, regarding the special case in Orleans County that has been ongoing, we have identified some folks, and they are under quarantine, mandatory quarantine. And if symptomatic, they have been swabbed as indicated, and we're waiting for those test results, but they are all in quarantine and being monitored. Again, this patient remains out of state, so she is not here. Overall, in Orleans County, 2 people are under precautionary quarantine and 12 people are under mandatory quarantine. And again, 0 under mandatory isolation. As we shared yesterday, we continue to tell the story of our Genesee County case, and we continue to explore close contacts and place them under the appropriate quarantine as we go back. And that investigation is still ongoing, but we feel we do have a very good handle on that case, and as far as the people that were directly exposed to that case, and they again are under appropriate quarantine and swabbed as indicated. Overall, in Genesee County, 5 people are under precautionary quarantine. 5 people are under precautionary quarantine, 16 people are under mandatory quarantine, and 1 person, again, is the positive under mandatory isolation. Just to share a little bit more of some of the folks that are under mandatory quarantine, we were asked a question yesterday about illness and symptomology of them, and 39% of them are presenting with some level of respiratory illness, and this is combined between both counties. But I do want to remind folks that these symptoms can be related to any respiratory illness. It's not necessarily COVID-19. It could be influenza. It could be any other of the respiratory illnesses that are circulating this time of year. So again, 39% of them are presenting with some symptoms, but they are all quarantined, and the ones that are symptomatic have been swabbed. We're waiting for results to come back from the labs. Also, as a reminder from yesterday, this is very important that as we quarantine folks and we isolate folks, there's an official capacity being done through our local health departments. And again, those are done with official orders signed by me as the public health director, and those are the folks that we are monitoring directly. We are aware, and as we've been saying, private providers and health systems are swabbing on their own, which is what we want to see happen. But with those folks, the providers are telling them that they need to go home and self-isolate or self-quarantine. This is very important because once you're tested, maybe 3, 4, 5 days sometimes get those results back, and we do not want folks walking around our communities who have been tested for COVID-19. And this is regardless, again, whether it's COVID-19 or influenza or something else. We want you home if you're symptomatic. So heed your health provider's warning. Stay home, wait for those test results, and obviously do not go back out into public or be around, again, those high-risk populations, the elderly, the immune compromised, and those with underlying health issues. It's very important to protect them during this time. One thing we want to talk about real quick today, we haven't touched on it too much to this point, but we've been hearing a lot of calls and questions around younger folks, young adults, mid-age adults, thinking that they're not affected by COVID-19 and that they don't need to worry about it. We do want to reiterate and hear clearly that anybody can get COVID-19. Anybody from birth through the senior ages can get COVID-19. So we need to remind folks that just because you may feel invincible, you feel strong, you're not going to get sick, you still can. You may have mild symptoms. That's one thing that we know about this virus, is that 80% of our folks, and again, the younger population, may not be showing a lot of symptomology. It may be a very, very mild case. And if they think that they're not ill, they may be out and potentially exposing folks. So it's very important that even if you are younger, you feel strong, that you are helping others by protecting yourself, staying away from them. Again, if you have symptoms, etc., it's just the messaging we're continuing to push out. All right, as far as swabbing, so we've been talking about this all week, and I'm not here today with better news, unfortunately. I don't like to keep coming before you guys and telling you that we do not have an abundance of swab kits available for our region, but unfortunately I'm here today to do that again. We continue to remain very frustrated over this. Again, Tim Yeager's here, and I know Dale Banker's up in Orleans County, and they are continually putting these requests in every day, multiple times, trying to get swab kits, get PPE, get other basic precautionary things that we need in our communities to effectively respond to this outbreak. And we're doing our best, and we're really working hard to get those. So again, if you are symptomatic, the best thing you can do is self-isolate, stay home, call your provider first, don't show up at their office, and discuss with them your symptoms. They will, if they have the kits, work towards getting you swabbed. And if they don't have the kits, they're going to ask you to stay home and self-isolate while we wait through that process. Again, lab testing is another issue. So getting the kits is one problem. Actually getting them tested at the lab after we swab is becoming another problem. As I mentioned yesterday, Erie County Public Health Lab is still waiting on reagents, so they are not testing at the moment. We have many samples that are there where we continue to wait on them. Again, a very frustrating thing, and we continue to partner with our healthcare systems to use some of the private labs. But again, as the testing goes in and they can't handle that capacity, it gets backed up. We are hearing 3 to 5 to 6+ days sometimes now on some of these samples we're sending in. And again, very frustrating to us on the public health side and our folks that are in quarantine when they're waiting for these results to potentially clear them. It's very frustrating. We just ask for their patience and understanding. It's out of our control, and we're doing everything we can to remedy the situation. So again, we're continuing to explore those options as far as community swabbing sites. We have our folks planning and looking at different logistics around those, but at the moment we have nothing to announce since we don't have the kits to do them. So stay tuned. We will be providing more information on that as we can. One thing I do want to talk about is our partnership with our local healthcare systems. As mentioned, Dan Ireland is here. He's going to talk in a minute, and he's going to share a little bit about what UMMC and their health system is doing around some swabbing locations at their site and the details of those. So pay attention to that when he comes up. I know also in Orleans County, talking with Mark Sy and Orleans Community Health, we're in discussions around doing something very similar to what you'll hear down in Genesee County, and we'll be, again, sharing information further when we know in the next few days. Again, just a reminder, for schools, again, talk to your local schools. If you have questions in regards to feeding schedules, to different activities, online learning, every school is doing a little bit different with this, and it's very important that you talk with them directly. They're going to provide you the most accurate and best information on that. I also want to, again, just remind folks of our mental health lines. Again, as we talked about yesterday, this can be a difficult time for people with anxiety and just uncertainty of what's going on, both publicly and in their personal lives. So we want to make sure that you're using the Care and Crisis line. It is available to you 24/7, and we want to make sure that you're utilizing that. That information is available on the websites and is out there in the different releases that we continue to put out. Another thing of note, we keep getting calls around people saying they have FDA approved at-home test kits. I'm here to tell you right now, there are not any of them. We would know about them. We would be using them if they were available. So just be cognizant of scams, right? So these are occurring very frequently for every different thing. PPE, we've heard that people are selling masks kind of on the black market. These are not certified. They're not coming with any type of guarantee and certification that we would have for protections that we typically see. So just a reminder to folks, if it's on the internet, some of these things, again, we know are not factual, and just be wary, all right? Because we don't want people getting taken advantage of during these challenging and difficult times. The last update I just want to make people aware of is the Orleans County website is back up and running today. I know the last couple of days it has been down due to a hack, but that is back up and running. So again, the health information is available at the Orleans County Health Department website, in addition to the Genesee County Health Department website. So please go there. We are updating our numbers daily. We are not going to be doing these press briefings over the weekend. So again, if you want to know the current numbers, we may get results back over the weekend. So we will be announcing those and putting them up on the website, followed with press briefings. The last thing before I turn it over to Dan is just I want to give a little perspective on flu. So influenza still is very prevalent in our communities. We've been talking about this in our press releases throughout this COVID-19 outbreak. Just so folks have a little bit of understanding of the numbers, Orleans County had 24 confirmed cases as of the week ending March 7th that week, and 249 cases for the season. Genesee County had 32 confirmed cases and 562 cases for the season. The main point here is influenza is still very prevalent in our communities. Again, a lot of the folks that are calling with respiratory issues, not saying it's not COVID-19, because we know there's some community spread going on here, but there's a higher percentage chance it is influenza. And again, we've been talking about this every year and throughout influenza season. The precautions, what we want you to do if you're infected, is the exact same messaging. Stay home, wash your hands, call ahead, etc. Also, in line to support this fact is we have been receiving negative test results back from the labs, again, from provider testing. And with the numbers coming in, I think we received 6 or so today that were negative, again, supporting that more than likely it was influenza or another respiratory illness that these people were, that was ailing them and that they had symptomology from. So again, just keeping in perspective that there are other respiratory illnesses. Sinus season is starting with allergies, etc. And it's going to make it difficult for folks. And again, that's why we're working really hard to flatten the curve, to push it out further so that we can, again, have capacity in our health systems to respond to those that may need assistance with COVID-19 illness. And by the way, you can still get your flu shot. It's still available. It'll still help you. So I'm going to keep pushing that message over and over again. So feel free to make sure you do that if you have not. So at this point, I'm going to turn it over to Dan Ireland with some updates at UMMC. And after that, we will open it up for questions. Thank you.
Thank you, Paul, and thank you, Jay, for having me here today. On behalf of Rochester Regional Health United Memorial Medical Center, I want to also thank our community for the tremendous support we've seen over the last couple of weeks as we've ramped up our response to COVID-19 and the situation at hand. We continue to do surge planning like many other hospitals across the nation. Our command center is active at the hospital with a leadership team overseeing all the efforts that are going on to make sure that you, our community, and our patients and staff are kept as safe as possible and receive the same high quality treatment that you come to expect from your local hospital. As we continue to look at those increases in volumes, we definitely are looking at what we need to do next and trying to stay one step ahead of what could happen. All of the data that we look at does indicate that a surge is possible and likely going to come of patients that will need hospitalization for that, although a smaller percentage, the percentage of patients who will need to be put into a hospital and cared for. And we've seen across the country as well as across the globe where hospitals become overwhelmed. And so one of the efforts we're going to be doing is proactively getting equipment set up and in place to prevent that from occurring. This could include things such as treatment tents that may go up around some of our campuses. And I'm here today to let you know that while we're planning for that, we don't want people to get the wrong impression when we go about setting up those tents. We will keep the community informed as to what those tents will mean. as well as other equipment and revise potential traffic flow around our campuses. Some of that work could begin as early as next week, again, just to be proactive. We still have beds in the hospital today. We still have plenty of capacity today to take care of patients. We're looking to tomorrow and making sure that in the days ahead, we're ahead of that. So please keep an eye on both our website, information we'll provide to the county partners, and potentially at these briefings as to changes that might happen at the hospital over the coming weeks. The other thing, and as Paul indicated, we want to emphasize as well is social distancing, stay home, and when it comes to accessing your medical care, call first. And I think it's most important we let everybody know, please contact your provider office before seeking care, especially if you have a new onset illness that you need to go over with the provider. They will provide you the best guidance. We have begun to roll out through Rochester Regional Health and through our local clinics, telemedicine, both video and phone capabilities. So those patients of the Rochester Regional Clinics would have the ability to use a video telemedicine through the MyCare portal at rochesterregional.org. So that's proving to be very effective in allowing the doctor to have an eye on you and determine whether you should even need to leave your house or whether you could stay or whether there's a referral to go get tested. With that said as well, one of the areas that we have seen increased volume because the doctors have been referring patients that potentially do need to be screened and obtain samples is at our Jerome Center campus. And so we have lots of services at the Jerome Center campus, including lab and x-ray, as well as our urgent care service. Our urgent care service has been the point where we've asked primary care providers to refer their patients if they want them screened additionally or looked further so that we can take care of that. That's only happening when doctors advise their patients to do that. But with that said, and expecting more volume, we're taking a proactive step of moving our outpatient lab draw for lab services only. We're going to move that to the Rochester Regional Health Laboratory draw site located at the City Center, 106 Main Street, Suite 47B. That's the one on the west side of the City Center campus, facing the Wendy's area in that direction. Beginning Monday at 6 a.m., that lab will open for a lab draw only. I want to reiterate, this is not a location to get COVID swabs or to be tested for COVID testing. This is for everyone else because the business of healthcare has to continue. We have to continue to treat the people who need regular lab testing for other things. And we want to be able to offload some of that volume from the Jerome campus and put it over at this location. That location formerly was operated by Rochester Regional Health, and so it is set up to be a lab draw station, and we were easily able to move our services over to that location. So again, reiterate, beginning Monday, lab draw services only from 16 Bank Street. We'll go over to 106 Main Street, the City Center for the draw at that draw location. Again, if you need lab and x-ray, you're still going to Jerome Center. And if you need urgent care, occupational health, or Batavia primary care, you would still go to the Jerome Center for those services. But for some of you, you just need your blood work, we can take care of you at that location. Overall, we are confident that the work and the support we've received from Paul's team, from Tim Yeager's team, from the city of Batavia, the fire department and police, have been fantastic. We call and ask, they respond. They're giving us a lot of support to make sure we're ready to take care of our next patient and ready to take care of our community. And we will stay the course, continue to monitor the situation, work with our Rochester Regional Health partners to make sure you have the care you've come to expect in your community. And I could just encourage you again, please make sure you wash your hands, just like I'm going to do because I touched the podium. Sorry, Paul, I do trust you. But wash your hands and take care with the social distancing. Thanks for having me here today.
Questions?
Okay, so we'll open it up for questions if we have any for, obviously, Tim Yeager's here for emergency management, or Jay for any type of county operations questions, and Dan on what he just talked about over at the hospital.
So Howard Owens with the Batavian. I got a kind of a four-part question about the flu, Paul, and I'm glad you brought it up because it was one of the things I wanted to talk about today.
Okay.
First thing is there anybody hospitalized currently with flu? During this season, number two, have there been any fatalities in our area related to flu? And then as far as if you got a test for influenza and it was negative, would that tell you anything about the likelihood that you have COVID? A, and B, have any of the people that are awaiting swabs, were they tested for flu?
All right, so you're throwing, this is tough, a four-part question. So the first part of this is, in the community, again, we have these different numbers that we've been seeing widespread. We don't typically get direct results on flu deaths. So a lot of them are just reported, obviously, complications of the flu, pneumonia, things like that. As far as hospitalizations, I mean, Dan can speak to potentially numbers within the system here locally, but again, they may be complications from the flu. The only thing that's reportable is pediatric deaths related to flu, and we have not had any of them in Genesee or Orleans County this year. There have been, I believe, 1 or 2 in Monroe County and 9 in New York State. So again, we've been talking all flu season about how severe this flu season is compared to most. It's been one of the worst on records. The severity of it is worse than we saw back in 2017 and 18 when we had that high number of cases. So again, for tracking purposes wise, we're not able to report any flu deaths per se, but we do know that people have died from complications of the flu locally here in our counties. But we have had 0 pediatric deaths, which is a mandated reportable death. As far as the testing part of that, so under our guidelines, at least initially when COVID-19 was starting to hit New York State, the guidelines were that, at least from the health department side, we had to require the flu test be done first, along with any other respiratory panels be done to rule out potential cause. Again, with it talking about it being so prevalent in our communities, we had to, again, try to isolate out and see if there was potentially other causes of COVID-19. I do know that many providers have moved away from that, and they're just looking at any respiratory illness and ordering testing done. I do know that some of the labs are still running for flu and other respiratory first, and then following up with COVID-19. So again, it's a process of trying to rule that out. And I think as we start to see more community spread here locally in our communities, potentially testing for all these things, even COVID at some point is not going to be as relevant because we know it's here, and we're going to treat all the respiratory illnesses very similar. Again, stay home while you're sick, don't go out, those type of things. So it's kind of a moving target, but yes, typically they are screening in some instances, depending on where you're going and what lab they're using. But COVID-19 obviously is definitely something that will be the fallback. If those come back negative, they will test for COVID-19.
And my only other question is, well, should I go ahead or somebody else talking? Okay. My only other question would be, there's been reports, and you kind of touched on, that younger people can get this too. They're not immune from it. But there's been reports that 38% of the people in intensive care for COVID-19 are between 20 and 54. I'm just wondering what you make of that. Are we seeing higher numbers in the U.S. For younger people being treated, or kind of what do you make of that?
So our connection's a little bit broken up, but I think it was around the younger, again, that younger population I touched on a little bit, and the concerns that we have with them around COVID-19. Is that correct?
Yes, and that 38% of the people in ICU are between 20 and 54.
Yeah, so I think that just reiterates and hammers in on the point that I made, that this is not an illness that is only something that our seniors need to be worried about, or those that are immune compromised. I mean, obviously, those are our highest concern points. If you look at fatalities, again, those are primarily, most of them are all in that elderly bracket or underlying medical or other health issues. But with that being said, again, younger folks can get this. Obviously, not everybody is super healthy, even if they're in their 20s or 30s or 40s. We have high rates of obesity, heart disease, other chronic health issues that roll into being complications for respiratory illness, right? I mean, if you're obese or you're a smoker and you have reduced lung capacity, those are all issues that they can be compounded upon flu, respiratory illness, or COVID-19. So I think that the numbers we're seeing are reflective of people maybe in poor health, other underlying medical health issues, and that's why we're seeing some of them in our ICUs. Again, It doesn't appear that a lot of them are on the mortality side and dying from COVID-19, but it is something that is why we're stressing for everybody to take this seriously and to help protect yourself and help protect others by, again, heeding the requirements and the guidelines put forth by the federal government, the state government, and here locally.
Thank you.
Yep.
Other questions from the media or anybody else who's attending remotely?
Any other media questions? If you want to ask a question, you need to unmute yourself, and then you can ask your question. Okay, if there's no other questions then we'll wrap it up. We'll continue to provide updates and briefings ongoing as needed, and we'll make sure to get that information out to the media so they're aware of those and we can have full participation. And again, stay safe out there. Make sure, again, you're calling ahead and doing your best to social distance as we've been talking about. Thank you.